FAPI in PET imaging. So this is my agenda which I am going to present here. So moving with my introduction. So FAPI, which means the fibroblast activation protein inhibitor. So it is mainly used in the PET imaging, which focuses the targets the cell of the tumor in the tumor population. So it is expressed as cancer associated fibroblast. So this is here we use the gallium based FAPI. So this acts as a lesion targets and shows the low background sequel, which gives the excellent imaging features. So it's especially it is used in oncologic imaging. Furthermore, we have to know about the cancer associated fibroblast. So here we can see the cancer associated fibroblast which is present in the cancerous tissue. So which is a tumor cells. So this help in its growth, invasion and metastasis. So furthermore, we have to know about the fibroblast activation protein. So it is a surface glycoprotein which is absent in the normal tissue, but it is present in the tumor cell. So it is expressed in the surface of the cancer associated fibroblast which is present in the cell membrane. So it is a novel target for this molecular imaging. In addition to, we have to know about the mechanism of this FAPI. So FAPI is a radio tracer tagged pharmaceutical, so that can be employed in PET. So it targets the FAP in the cancer associated fibroblast, thereby making only the cancerous tissue away, which means the lesion shows the increased uptake. So the FAPI inhibitors, which is used for the theranostic molecular probes. Theranostic means it is used for the therapeutic and diagnostic purposes. So activation of the fibroblast occurs in the tumor surrounding in the conditions of benign and malignant. In addition to, we have to know about the advantages of the FAPI. So it shows low false positive rate, high tumor specificity, faster imaging and tumor to background ratios. Furthermore, we have to know about the gallium generator which produces this gallium-68. So here this gallium generator is used in the nuclear medicine with a positron emitting radionuclide which is gallium-68. So the parent isotope which is the germanium-68. So it has a half-life of 270.95 days. So from this, the gallium-68 with a half-life of 67.71 can be easily eluted from this generator at the place of application. In addition to, we have to know about the gallium-based FAPI. So this gallium-based labeled FAPI, which provides a favorable image features in the terms of high detection rate in a variety of tumors compared to the FDG PET. So comparatively, we can see there is a low effective dose compared to other traces. So here you can see the FAPI PET have 1.4 to 1.8 millisievert effective dose. Comparatively, you can see there is a gallium dotatate which shows 2.1 millisievert and FDG will have 2 millisievert. In addition to, we have to know about the radiopharmaceutical. So which dose range we have to going to give to the patient. So this FAP specific inhibitors are firstly developed as an anti-cancer drugs. So then it is introduced into the tumor targeting radiopharmaceuticals. So here the injecting activities were depending on the labeling yields, which is based on the diagnosis. So the dose range is about 3.2 to 9.0 millicurie. For example, I here denoted that breast cancer will have the dose of 4 millicurie. Hepatocellular carcinoma has 3.5 millicurie. In addition to, we have to know about the biodistribution. So biodistribution, or it is also known as tumor uptake in the patient, with quantified by SUV max and SUV mean. So SUV max, which means standardized uptake value. So it is at the 1 hour after injection for gallium FAPI, it is acquired in the transaxial slices. So normal organ will shows the 1 centimeter to 2 centimeter diameter SUV value it is placed inside the oran parenchyma, while the ROI is placed in the any lesions. So the average SUV value will be greater than 5.5, especially for the malignant lesions. In addition to, we have to know about the applications which are used in FAPI imaging. Example, we can do for the cases like breast cancer, gastrointestinal carcinoma, pancreatic carcinoma, lung carcinoma. In addition to, we have to know about the patient preparation. So patient preparation must be no diet and fasting. Unlike the PET scans, FAPI PET scan they generally don't require a low carbohydrate diet or fasting to the scan. Avoid sterness, exercise. Medical history must be provided from the patient. RI on the time and informed consent from the patient. So moving through the techniques, first we're going to do the tracer injection to the patient. So the small dose of the FAPI tracer, which is injected intravenously, which is labeled with the radioactive type isotope, which is a gallium. So then this dose will be circulated through the body and binds to the fibroblast activation proteins, which is present in the tumor cells. So it shows completely uptake in the tumor. So moving to the patient position, so place the patient in supine position with hands raised above the head and extend the leg. Breath hold must be in inspiration. So connecting tube from the injector is connected to the ventral aiding gauge. So furthermore, we are moving to know about the scanning phases. First, we are going to take the scan phase of chest plane to detect any pulmonary nodule in the lungs. So moving through the next arterial phase, which shows it is useful for evaluating the hypervascular lesion like hepatocellular carcinoma, and it shows the visualization of arteries. So if needed, we can take the portal venous phase for especially the liver detection cases. Example, it shows the portal vein enhancement. So delayed phase is taken. It is useful for detecting the malignant and benign lesion. And here we are going to see about the PET scan, which is planned with 10 to 15 beds. So here we can placing the each bed. So each bed takes about 2 to 3 minutes. While taking that, it acquires about 30 to 45 transaxial image dynamically. So then we are going to take the brain scan, which shows any mets in the left frontoparietal region. So these are the post-process technique they are hot metal image, rainbow color scale image, shaded surface display, volume rendering and cinematic rendering. So moving through the cases, this is a case of hepatocellular carcinoma. Here see there is a FAPI which is expressing a heterogeneous lesion which is the rapid washout, which is seen on the segment of 4A, 7 and 8 of the liver. So it is likely to be primary hepatic malignancy. So the SUV max value is about 22.8. So moving through the next case, which is a breast carcinoma. See, there is a spiculated infiltrative lesions which is present in the bilateral breast. So the right breast which shows the SUV max value about 20.80. So here there is an infiltrative lesion which infiltrates the nipple of the areolar complex. Comparatively, you can see there is a multiple lymph nodes is present in the both axillary and internal mammary nodes. So moving to the next case, which is a CA urinary bladder. So here the FAPI will expressing there is a endophytic lesion appearing on the roof and anterior wall of the urinary bladder. So that SUV max is about 5.7. So in addition to we have to know about the difference between the FAPI and PET FDG. So here the FAPI in the PET CT shows a higher tracer uptake and better tumor detection compared to FDG. So comparatively you can see here there is a high hepatic background and here the low hepatic background. So here it will denote say FAPI have low SUV value. I can denote here this is 1.7. So FAPI have advantage for the liver metastasis cases. So in addition, FAPI PET can be performed in 10 to 1 hour after the administration can be done without fasting and resting time. Take home message to everyone. So gallium based FAPI for the PET image with a radio tracer which help to detect the small primary or metastatic lesion in crucial organ like brain, liver, pancreas and gastrointestinal tract. So this FAPI has a highly promising molecular agents which is particularly in tumor which is known to have a clinically significant inflammatory or fibrotic compound, and FAPI will have in the favorable diagnostic accuracy. So here I told FAPI could replace the FDG PET as a well established role in oncologic PET imaging. These are my reference. Thank you.